Today, let's learn how to use health and sickness vocabulary in Tagalog. Discussing health and sickness is crucial in any language, especially when seeking medical attention or providing care for others. Knowing the appropriate vocabulary can aid in effective communication with healthcare providers, express your symptoms clearly, and understand the medical advice given by the professionals. This guide will introduce you to essential health and sickness vocabulary in Tagalog, helping you navigate healthcare scenarios more confidently. Here are some of the words that form the basic health vocabulary in Tagalog. First, we have the word kalusugan, which means health. Malusog, which means healthy. Sakit, which means illness or disease. Gamot, which means medicine. Klinika, which means clinic. Hospital, which means hospital. Doktor, which means doctor. And nurse, which means nurse. The most basic symptoms here are the Tagalog words. First, for headache, we say masakit ang ulo. Similarly, for stomach ache, we can say masakit ang tiyan. For toothache, we also have masakit ang ngipin. For fever, we have lagnat. For ubo, we have cough. And lastly, for cold, we have sipon. Here are some of the ways that expresses how you feel in Tagalog. First, we have hindi maganda ang pakiramdam ko or I don't feel well. You can also say masama ang pakiramdam ko, which means I feel sick. Now, if you are feeling tired, you can say pagod ako. Or if you feel dizzy, you can say nahihilo ako. Of course, aside from understanding your symptoms and stating how you feel, you would also have to seek for medical help and also understand instructions provided by the doctor to further improve your status. First, here are some of the phrases that you can use to seek for medical help. First, we have, kailangan ko ng doktor or I need a doctor. Another, pwede ba akong magpatingin or can I get a checkup? Now, if you are given medicine or if you want to ask if there is medicine for your diagnosis, you can say, mayroon po bang gamot para dito? Or is there medicine for this? On the other hand, if you are given medicine and you would like to ask how you should take it, you can say, paano po ito inumin? Or if you want to ask how often you should take the medicine, you can say, gaano kadalas ko ito iinumin? Or gaano kadalas ko ito kailangang inumin? Now, if you want to ask about what you should do to further improve your health, you can say, ano po ang dapat kong gawin? Or what should I do? Now, let us see if you actually learned from today's lesson. For the first situation, you would like to ask how often you should take the medicine. You can say, gaano po kadalas iinumin ang gamot? Now, for our second situation, the doctor asks what are your symptoms, and you want to say that you have fever and headache. You can say, nilalagnat at masakit po ang ulo ko. Your sister asked you where you went, and you want to say that you were from a hospital for a consultation and was told by the doctor that you are healthy. You can say, pumunta ako sa ospital para magpakonsulta at sabi ng doktor, malusog naman ako. To further assess your knowledge about today's topic, let us have our assessments. For the first assessment, translate the following Tagalog phrases to English. For the second assessment, it is a multiple choice question. Thus, select the best answer for each question.